Hi, welcome to my channel. Welcome back. It's been a few days since you saw me. Last time I spoke about how to make that beautiful cornbread dressing. I hope you guys had a wonderful holiday season and I hope you tried some of that cornbread. And if you didn't, you still have the opportunity to do it for Christmas. Hey. So, how are you guys doing? I hope everyone is keeping well. I hope if you are ill at this time, I hope you're comforted by some family member or friend. I wanted to talk today about a form of cancer that is killing a lot of Black women. Today, I'm going to be talking about the triple negative breast cancer, and I'm sure a lot of you have heard about the triple negative and you wonder what is that, but you don't really know what it is. So let's talk about the triple negative breast cancer. In past videos, I did talk about cancer and what happens, when cancer occurs in your body. We did talk about cancer being an uncontrollable multiplication of cells. And we said breast cancer, of course, is uncontrollable multiplication of cells in the breast occurring, whether it's in the ducts, whether it's in the lobules, or whether it's somewhere in one of your lymph nodes under your arm or whatever. So today we are talking about triple negative breast cancer. What happens in cancer is that the cancer cells has what you call receptors on the surface of the cancer cell. They're receptors, and these receptors, they love hormones, and they can only grow and become aggressive in the presence of hormones. And when I say hormones, I'm referring to the estrogen that we women produce. I'm talking about the progesterone, and I'm talking about another protein called HER2/neu. And so most of the cancers that are happening have the receptors on the cancer cell that allows it to multiply and become aggressive. So most of the cancer cells are hormone positive or estrogen receptor positive cancer cells. But in triple negative breast cancer, you find that the cancer cell does not have the receptors on the cell that attracts the hormones like the estrogen, progesterone, and the HER2/neu. So because it doesn't have it, most of the medications that are used to treat triple negative breast cancer is not hormonal, because you do not have the receptors for the estrogen and the progesterone. So triple negative is negative for estrogen, that's the receptors on the cancer cell, negative for progesterone, that's another hormone, and negative for HER2/neu. Triple negative. So all three of these receptors are absent on the cancer cell. So that triple negative breast cancer, actually about between 10, 15, and 20% of breast cancers are triple negative. And most of the time it's happening in African Americans. It's happening in white women, but it is a cancer that is more common in African Americans. It's also common in Hispanics, but more in African Americans. And we'll talk about the percentage and how it occurs in a minute. Most of the time it's happening in women who are younger than 50 years old. And of course, like I said, it's more common in African Americans. The triple negative breast cancers that are happening are usually, remember we said it can happen in the duct, and we said that sometimes the cancer is invasive, meaning it's penetrating through the tissue in the area. So most of the triple negative breast cancers are invasive, that is, it's penetrating the tissue in the area, and it's usually happening in the duct. So it's usually invasive ductal carcinoma or invasive ductal cancer. And so the prognosis of this cancer, this is a very, very aggressive cancer. And when we talk about prognosis, we're talking about the likelihood that you're going to survive this cancer within 5 years at least. And for triple negative, it's very poor. It's very poor prognosis. Although treatment for triple negative is now, improved. I mean, they're finding more drugs to treat that cancer. Well, in the past, they were just limited number of drugs to kill that cancer. But now it's better, but it's still worse than the estrogen receptor cancer cells. So the treatment is really limited. And the prognosis is poor. And we find that many of our young women, I come across a lot of 35, 39, 40 plus women dying from breast cancer in the African American community, in the Black community. And most of the time they are dying from the triple negative breast cancer. So what is the prevalence? I mean, how common it is among the ethnic groups? How common it is in African Americans? How common is it in Hispanics? And how common is it in non-Hispanic whites? So the data is 21% of the triple negative breast cancers are happening in non-Hispanic Blacks. So it's happening more commonly in Black people. And in Hispanics, 12% of the triple negatives are happening in Hispanics, and 10% are happening in whites, right? That's the non-Hispanic whites. So we find that the risk factors are one, ethnicity. Blacks, it's happening more common in Blacks. And it's been determined that the rates of breastfeeding is lower in Blacks or African Americans, and that places the woman at risk. Remember, we said that one of the risk factors for breast cancer is the absence of breastfeeding or, short period of breastfeeding. The other thing is Blacks tend to carry more fatty tissue in the abdomen. So you find there are more Black women who are overweight and have the excess fatty tissue in the abdomen, and that places you at risk for the triple negative breast cancer. So the triple negative cancer, although it's an aggressive form of cancer, but there is still hope. It still can be treated. We did say that it cannot be treated using hormonal treatment because it doesn't have the receptors on the surface of the cells that makes it amenable to hormonal treatment. So the treatment, of course, surgery, mastectomy will be done, and radiation therapy, of course, will be used to treat the triple negative, and chemotherapy. A little difference between the chemotherapy that is used for the most common types of breast cancer is that they're using the platinum-based chemotherapeutic agents. So they're using more the cisplatin, and these are the some of the chemotherapeutic agents that have been used for many years, and they have really more side effects than the regular ones that we use for the estrogen receptors and breast cancer. So these drugs, the cisplatin, are the ones that are used for the triple negative breast cancer. Frequently, if a woman is diagnosed with triple negative breast cancer, they may be placed in a clinical trial. A clinical trial is a study that's being conducted, and what it's doing is looking at various drugs and see how effective it is to treat whatever illness. It could be breast cancer or liver cancer or any form of cancer, actually. And there are lots of clinical trials going on as we speak. So one of the things the doctor may do when the woman is diagnosed with breast cancer, he's going to look at the different options. Number one, he's going to look at at what stage is that cancer. Is it stage 1? Has it spread to the large organs like the liver and the lungs? And if he determines that the patient may benefit from clinical trial, he will probably, tell you all the clinical trials that's happening in your area, and he may refer you to, whatever hospital is conducting that clinical trial. And I know, a lot of people are afraid of going into clinical trials, but We know that they have to come up with new regimens to treat cancer. They must come up with new drugs. And one of the way they test the drugs is by using human subjects. And sometimes, well, most of the time, they use rats, of course. But they will try it on humans to see really the true impact of that medication on the disease process. So clinical trials are beneficial, and the other thing about clinical trials is that you are not paying for the medication. So it's very good. If that woman is in the late stages of cancer, especially the triple negative breast cancer, they probably will recommend going into a clinical trial. And there is a website that you can go on to find out whether there are clinical trials in your area. And it's called breastcancertrials.org. When you go into that website, you will place your zip code and it will direct you to any clinical trials happening in your area. And so that is triple negative breast cancer. It is very aggressive, it is very deadly, and we see a lot of our young Black women dying. As a matter of fact, I was having a luncheon very recently, and I was calling around, trying to invite some of the ladies we have supported in our foundation, and at least 2 or 3 of them had passed, and most of these young women, some of them were 30 plus, they were 42, they were dying from triple negative breast cancer. So what you need to do, as we have said in the past, is to be very vigilant. And although they are not really advocating, breast self-exam as much as they were doing in the past, but they're encouraging you to have your annual mammogram. But I still believe you need to know your breast in the event that something abnormal shows up. You need to immediately consult your physician if you see something is wrong with your breast, whether it's the presence of a lump that wasn't there, or whether your breast is warm and swollen and red. And if that happens, you want to make sure you're consulting your physician, because you may have regular breast cancer, you may have negative breast cancer, or you may have the inflammatory breast cancer. So we want you to be vigilant and make sure you are always being conscious of what your body is all about and what any changes that are happening in your body. And so take care of yourself, ladies and gentlemen, because we do know that breast cancer also occurs in men. We want you to take care of yourself, and if anything shows up, we want you to consult with your physician. If this is the first time you are watching this channel, we want you to go ahead and hit the button on the right side of the screen. We want you to subscribe and hit that bell icon, so when we release another video, you will receive notification. Thank you so much for watching. It's my pleasure to bring you the information that you may not be familiar with. We're all in the learning process. None of us know everything. And so I love to do the research and bring it to you guys so you can be vigilant and know what to look for to keep yourself healthy. Every now and then I'll be bringing topics that are not necessarily breast cancer, but health topics that I know you may benefit from. So keep watching, and thank you for subscribing, and see you next time.